to the American people on this issue and slip it in the dead of night.
You heard Robert Gibbs say that that was just ridiculous. Joining me now, Texas Republican Senator Kay Bailey Hutchinson. You've been in the Senate for a number of years. Describe for me, if you will, the level of animosity among your colleagues.
Well, I do think that there is a high level of tension. People are tired. We've had votes at 1 o'clock in the morning in the last couple of days, and there's tension because there's such real disagreement about the policies in this bill. Disagreements about the new taxes, the mandates on business, the Medicare cuts. All of this has caused tensions to rise, that's for sure.
You know, one of your colleagues, Senator Claire McCaskill, is asking why there's such disagreement about what's in the bill. Let me play what she pointed out this morning on Morning Joe.
For whatever reason, the Republican Party has decided that to defeat this issue is more important than what's in it. Everything they wanted, no public option, it's out. No single payer, wasn't considered. No trigger, it's out. Paid for, deficit reduction, it's there. Bring down health costs, it's there. Frankly, the cuts to Medicare that they want to pound the podium about right now are ones that they've proposed over the years.
Do you disagree with her?
Oh, yes. Of course, the Medicare cuts that were proposed by Republicans were $10 billion over 5 years. This is $500 billion over 10 years. You're talking about decimating the Medicare system, stopping the service that is given in Medicare Advantage, cutting hospitals. That's for starters. Secondly, they say it's a balanced budget. Well, it's a $2.5 trillion price tag. How are they paying for it? With taxes and mandates on business and individuals and families in this country. How much more tax increase can our businesses afford and still try to create jobs in a very bad economy with a terrible unemployment rate?
I don't understand. Where are you getting that $2.5 trillion price tag? The CBO has come out with numbers that are far less than that.
Yeah, the CBO numbers start in 2010 for 10 years, but the costs don't start until 2014. So if you take the 10 years starting at 2014, it's $2.5 trillion.
Let me ask you, given the fact that the Democrats have rallied around this, that they will pass this, I mean, judging by the test votes, this thing is going to pass. Is it just at this point being mean to keep all the staffers here to force this thing out until Christmas Eve? Senator McCaskill said today, look, if the Republicans would get on board, we could get this thing passed today and let everybody go home for Christmas.
Well, I think that Republicans are trying desperately to have one Democrat look at this, hear from their constituents, and say, you know what, I'm not going to be a part of this, because they will all pay a price when the American people see what the costs and mandates are and the increase in health care costs. They say it's going to decrease health care costs. There's no way it can decrease health care costs when there are so many taxes on every facet of health care delivery that are included in this bill, and we are trying to talk about it. I am very sympathetic to the argument about the timing, but the Democrats set the timetable. They set it right up against Christmas Eve. They set all of these votes in motion, so I don't think that they should really be criticizing Republicans for trying to make one of them come to their senses and say we shouldn't be doing this so fast. It is 1/6 of our economy, and it is going to affect every American's quality of life.
It seems odd that in the Senate it seems so black and white, right down party lines, when to the American people there is so much gray in the middle, so many questions on both sides. Senator Kay Bailey Hutchinson, I appreciate so much that you've joined us today. Merry Christmas to you.
Thank you very much.
Coming up, we're following a Brazilian court order